So first you want to have the patient in a comfortable position. Looks like you're pretty comfortable there.
Very good. Yes.
Strong, good.
And then watch.
What's that?
Something like a watch.
Okay. And then I'm going to decide where I'm going to go, either on the outside or the inside. So with milking the fluid, you can kind of see sometimes the fluid will come back, and that's the purpose of the device, is to distend the fluid so it's under more pressure. And if this is pretty obvious that both of them, they've got fluid in the compartment, so I could use either one. So I'm going to go ahead and put this on. I'll let you hold his leg up there. So let me find out the spot I'm going to go first. So you go right underneath the kneecap here, right there, and then I use a marker pen because we're going to clean this with betadine. That goes right over the kneecap, and then secure the straps around so that's pretty snug. And then we'll be able to see in a minute with the ultrasound, when it's blowing up, this fluid will increase. So I'll go ahead and, just for demonstration purposes, inflate it. And usually go between 100 and 80. Does not need to go above systolic, that would be uncomfortable. So it's just like a blood pressure cuff. People are used to that sensation. And then you can see this is actually under more pressure now. Large pocket of fluid there. That's the bone and that's the fluid. As I push it in, it's going away, but I have to push pretty hard because it's under positive pressure now. So this fluid is much larger fluid than it was before. That space than that space. Now I'm going to deflate this device and continue looking at that space, and you'll see the fluid go away. It's going back into the rest of the joint space, which is inferior, superior, lateral, and inferior. So there's not much fluid. If you were to do an ultrasound right now, you'd have trouble finding exactly where that fluid is, but when you blow it up, I'm blowing it back up now, you'll see that fluid come back into the target area under positive pressure. So it's much harder for you to move it around now. You're not allergic to betadine, right?
No.
Okay. So we have a series of 3 swabs. We'll just go over here. Okay, here comes some cold spray. Mr. Brown. That makes the needle not quite as sharp. Okay, good. I'm just going to go in right where it's numb. We're definitely in the space. And I'm going to inject. I'm going to let you release the pressure. Once I'm done, okay, release the pressure. It's just now the pressure is out, so it won't bleed as much when you withdraw the needle. And we're all done. How'd that feel?
Couldn't feel the thing.
Okay. Raise up your knee just a little bit there. Thank you. And just loosely have it snug there. Good. Okay. And again, there's not too much fluid. You can see there is an effusion. As I blow that up, that'll be much larger. You can actually see the fluid bulge into the target space there. And because it's under positive pressure, usually I can remove fluid more easily. Okay, use the same needle but inject the medicine through the same needle. Okay, we're going to numb up the skin again.
Okay.
It looks nice and clean. It does not look infected at all, so that's a good sign. It looks pretty clear. By having it under positive pressure, we can use a smaller gauge needle. This is the 20 gauge needle. If I thought there was pus in there, I'd probably need to use an 18 gauge needle, and we'd numb up the skin as well.
36 cc's altogether.
Okay. I'll let you go ahead and release the pressure there. Okay, and then just a 2x2. Okay, all done. All right, good job.